Dr. Keith Lindor is here now talking about the Emerging Trends Symposium. And can you give us an overview?
Sure. This will be a day and a half of really all the major topics in non-alcoholic fatty liver disease. We want to give people an understanding of where the field currently is and where we think it's going to be moving. It's an exciting time. There's lots of new thoughts about what kinds of endpoints we might use to design clinical trials. And fortunately, many companies have developed an interest in new products that can be tested in this condition. So very timely to have this conference.
There has been study and discussion on non-alcoholic fatty liver disease for many, many years.
Yeah.
So why is this included in an Emerging Trends Symposium?
Well, I think one skeptical view would be that hepatitis C has moved along so far that now people are interested in non-alcoholic fatty liver disease. But I think really what we have seen in the 35 years or so in which it's been described is an emergence of how important it is, how common it is. We're starting to see issues of associated cancers around this. And I also think that anytime we have new potential therapies, that drives interest in a condition. And we've been fortunate in that many different pathways have been discovered, described, and are now being explored, and that's part of what this conference will deal with.
Let's talk about those and some of the research that may yield a change in clinical practice for patients.
Well, we're still fairly early in understanding this disease. So I think one of the things we're trying to better understand are amongst the roughly 100 million Americans afflicted with a fatty liver, which ones are going to be those that develop problems? Which ones should we be intervening in? And so predictive measures become very important to try and define how many patients and which patients are going to have problems. I think that as we start to do that, we can then start to develop a better understanding of what are the endpoints that we could look at in a clinical trial. Many trials for slowly moving diseases are infeasible to do if you're looking at death or transplant as an endpoint, so we need intermediate endpoints, lots of interest in that. And then I think it's because of all of the interest in this and people coming into the field, there are different pathways, anti-fibrotic agents, agents that deal with cytokines. This is a disease that's associated with a metabolic syndrome, so anti-diabetic drugs continue to be of interest. And there's just been a lot of interest in different medications and different pathways. So a very exciting time, very exciting.
And clearly a lot people can learn by coming to this. What do you hope that attendees will gain by going and then going forth after?
Well, I hope that what they come away with is an understanding of a better refined idea of who we need to be focusing treatment on. I think that we have to be more realistic in how we focus our treatments. Treating a third of the population and calling it a disease may not be right. But some of these people will go on to develop cancers or require transplant or consequences of end-stage disease. That's the group we need to discover and appropriate treatment for them. We also need to I think have a better understanding of how to design future trials. In many cases, as we start doing trials, we start learning more about the natural history and the risk. The clinical trials need endpoints that people can accept, and that's part of what we want to do as well, is continue that discussion as to what would be acceptable endpoints for clinical trials. And then I think the real excitement will be exploration of some of the early results of the different pathways that are being explored, the new medications that are being tested, and hopefully by the time the conference occurs, we may even have some preliminary results.
You've been so thorough, but before I let you go, anything else that people should know?
Hard to think of a nicer place to be in late March than Washington, D.C. Dr. Unasi has promised that the cherry blossoms will be at their peak.
Perfect. So we're learning, we're helping patients, helping physicians, and seeing the beauty of DC. Thank you so much.
You're welcome.